Chapter 3. Chapter 3 is going to cover workforce wellness and personal safety. Probably a highly neglected area in EMS altogether. We don't do a very good job of taking care of ourselves, and that's probably the rule rather than the exception. There are certainly people who do a fine job of taking care of themselves, but in this job, it's maybe stereotypical, but it's stereotypical for a reason. We don't do a terribly great job of caring for ourselves. We care for other people. Again, I remind you that listening only to this lecture is no substitution for actually reading and studying the chapter itself. All right. Again, same education standard that we've been touching on, and that's going to be pretty consistent throughout this first section of the course, or I should say first section of the book. This applies the fundamental knowledge of the EMS system, safety, well-being, the advanced EMT, as well as the medical, legal, and ethical issues to the provision of emergency care. There is a multimedia slide for you to watch, or actually it's a video that refers to aids. You won't be able to watch it from this lecture, but the non-narrated PowerPoints that you have in the course page we'll have that available for you to link to that video. Objectives, of course, are covered on pages 31 and 32 in your textbook. A number of those for this page or for this chapter as well. And this is where you would find that multimedia video. So, introduction. Components of wellness. And wellness is obviously a hot topic. We got personal trainers all over the place and life coaches and so on and so forth. And diet drugs are probably one of the biggest selling pharmaceuticals out there, as well as herbal supplements and so on and so forth. But the components of wellness includes emotional well-being, and that can be very difficult in this job. Social, you have to have some friends. It's good to have a backup network, a significant other at home. Spiritual, you can have a spiritual connection with, whether or not that's a higher being or a specific or non-specific spiritual belief of more of a holistic approach. Occupational wellness, there needs to be some resources available for us to do our job well and in a healthy manner. Intellectual well-being, you have to continue to grow with your intellectual needs, continue to feed your curiosity in order to continue to have a wellness of your mental state. Physical well-being, of course, that would be your body, taking care of your body, working out, so on and so forth. And environmental. If we don't have a healthy environment to be in, psychologically or physically, it takes its toll. It really does. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So those that are existing in the world and not doing things to improve their life aren't probably considered healthy by this definition. And I kind of like the way that they look at that and they compare it, because you're not maybe truly living. So healthcare providers are role models for health and healthy behavior. So we obviously have to think about that. Oddly enough, there are so many EMS providers that are smokers, and we see what smoking does. If you compare it to those that are strictly firefighters, it seems those guys that are running into smoke all the time really got the message. And those of us that see what happens when you do, we didn't so much. So we have an obligation to educate our patients on health issues. And if we can't be a positive role model for it, it's awful hard for our patients to take advice from us. So you have that active role in health promotion and public health. So you may be very upfront in the wake of the public eye, where people are seeing you at health fairs or or speaking somewhere, and if you're overweight and you're huffing and puffing and so on and so forth, it gives a negative message. So this goes back to your case study there. Talks about shift work and whatever. You can answer those questions. So the goals of Healthy People 2010. This is a program that obviously was started by the Department of Health and Human Services, trying to get people to be healthier within 10 years. I believe that actually started in 2000. So, and then there's a newer one, I think that's now 2020. But so it increases, trying to increase the quality and years of healthy life, and tries to eliminate some of those health disparities. So some of the health disparities might be lack of availability of health care. Maybe you don't have insurance. Maybe you don't have doctors in your community. So trying to eliminate a number of those things. Some leading health indicators that we look at, particularly, we should be looking at them at ourselves, but at least the healthcare system looks at, our physicians perhaps. Physical activity. So are you living a sedentary lifestyle? Depends on what your job is. I mean, my job, for example, my full-time job, I spend a lot of time at a computer, so I'm probably not nearly as active as I could be. Overweight and obesity. It's an epidemic hitting society, and if not the world as a whole, definitely the nation. Tobacco use. There is no benefit to smoking tobacco. There's no proven health benefit to doing it. You may have a general feeling that you may think you're feeling better, but there are so many toxins within it. It really, there is no benefit. There's absolutely no benefit. So substance abuse, whether or not we're using prescription items outside of the normal confines that they should be used, or we're using illicit substances. Responsible sexual behavior. Obviously, there's a number of things out there that'll come back and get you in the future. Mental health. Are we psychologically handling our situation? Are we repressing? Are we depressed? Do we have anxiety disorders? Injury and or violence. We can be injured either or from an act of violence or from accident, or potentially also intentional. Environmental quality. So where do you live? Do you live in an area where there's a high lead content in the soil and your kids are at risk? Do you live in an area in which radon seems to be an issue? You live near a chemical plant. Immunizations and trying to fend off some of those diseases that have the potential to take your life. And then your access to healthcare, of course. You live 3 miles from the nearest city, you probably don't have real good access to healthcare at a moment's notice. So some health and health behaviors determined by more complex and interrelated factors might include things such as your genes, your genetics. So if everybody in your family has died of a heart attack, you have to kind of stop and think about that. Am I at a higher risk? And in most cases, yes. Even some people that are super fit end up with heart disease. They've done everything right, but they end up with heart disease, and a lot of it has to do with their genetics. Their environment, of course, whether the environment is physical issues, or maybe it is actually more like the work environment that you're in. Cultural beliefs. Certain cultures have certain beliefs that things are folk remedies, or things cause illness. I mean, if you look culturally at some places like Asia, there tends to be a much lower risk of certain types of heart and vascular issues, and you got to look at the way that they eat. They don't eat the same ways that we do. Level of education in general, lower socioeconomic statuses, lower education levels tends to breed more risky behaviors, as well as it's not as easy to eat healthy if you don't got a lot of money. So, cheeseburgers 99 cents, a salad $6. I mean, that's just the way it goes. People have to live within their means. All right, so a different thing about it here, your partner smokes tobacco. You're concerned for his health and for the health of and your health as a secondhand smoker. And after a week of not saying anything, you point out the quit information in the emergency department. What else can you do to encourage him to stop? You can help him find other ways to battle this. I've never been a smoker. I've known many smokers, and I know a number of smokers that have quit. Some of them did it cold turkey, not very many of them. Some of them had to do it because of their health. They developed COPD, and it was either quit and have try to get some return of normal lung function and hopefully have some semblance of a good life, or continue to smoke and have a much shorter life. So there are other resources. Are there support groups? Is there people to talk to? Are there substances such as patches or gums and whatnot that you can encourage them with? Find some success stories and help keep his mind off of it when necessary. So Maslow's hierarchy of needs. Anybody who's studied really psychology, and probably sociology as well, has run into this concept. Abraham Maslow was a psychologist and a social scientist that was trying to identify what is it that humanity really needs. What do you need as a person? And he developed this model that kind of reflects the various potential needs a person has. There are certain physiological needs that somebody needs to have, such as they need to have a home, they need to have food, they need to have air and water. There are some other safety needs, such as security. So home also could be included there, where you're free from physical threat. You're able to get away and not have to worry about wild animals eating you in the middle of the night. Social needs. People have a need to interact with other people. Some people less than others. There's obviously introverts that don't need to interact quite as much, but people need to interact. They need to interact with other people. That's just normal. Esteem needs, so things that help you feel that you have a self-worth. And a lot of times that's more of the interaction helps you with your interaction with others, helps you with some of your esteem. But again, your contributions, your achievements that you've done also help play a part in this. And then self-actualization is when you've had all your other needs met, you're actually looking for the broader pictures of things. You're looking for something beyond yourself, actually, that is helping you to realize your fullest potential in the world. All right, so this is a relationship between stress and performance. On the left over there, going up and down, we see areas from low, medium to high performance, physical and mental performance, and our arousal level of low, medium, and high, and how do we perform. So what this basically is saying is if we have, we'll call it a stressed state, we're moderately stressed or we're moderately under pressure, and we're in our highest physical and mental performance, that's when we're going to obviously be at our optimal. We're going to be at our best. When we start to push too much, we have too much stimulation, we'll call it, then we start to slide down the hill and it starts to become a stress. So we can have angers and anxieties and whatnot. Interesting little bell curve chart, but I don't think earth-shattering by any means. Stress is the body's demand to any stimulus, So there are good stresses, there are bad stresses. There's good stress that we refer to as eustress, and there are bad stresses that we refer to as distress. So any major issue in your life, such as starting AEMT class, is a stress. It can be good, it can be bad. Getting married is a stress. Moving is a stress. Getting a new job is a stress. Maybe good, maybe bad. So they play different parts, and obviously losing a loved one or ending a long-term relationship, divorce, etc., play pretty heavy compared to, hey, I found a $20 bill in my pocket. That's awesome, and you're pretty all right with that for a little while, and then you move on. So it's a balancing act, all the good stresses versus all the bad stresses, and your level of stress that you have overall. So these demands that you have on you can be a stressor. So this demand, I imagine some of you right now are feeling AEMT class as a distress. It's a bad stress. But in the long run, I think you're going to find it was actually a eustress. You're going to find out that, hey, I did it, and now I can function at that capacity I want to. And then up to a certain point, an increase in stress actually helps us improve our performance. You may be the person who works best when they're under pressure and under a deadline. And that's actually fairly common because we increase a little bit of stress. We have that deadline. We know we got to get it done, and it helps us kick into a higher gear. Sometimes we're just procrastinators because that's the way we're wired. So the phase of a general adaptation syndrome of a stress model, we have an alarm phase in which our stress goes way up, and then as we start to acclimate to it, then we have a resistance. Eventually we get to the point in which we're not able to handle it anymore. We go into an exhaustion phase where we slide way down, and typically that's where it leads us to rest, and then we recover and hopefully bounce back. So it's really more of a biological description as opposed to a physiologic response to stress. An acute stress reaction occurs during or immediately after exposure to a stressful incident. You probably, the first time you went on an ambulance call, had an acute stress reaction. The pager went off, you dumped a bunch of epinephrine and adrenaline in your body, and your heart started racing, your mouth got dry, your pupils started to dilate, you maybe got a little shaky, started to get a little sweaty. That's a typical normal acute stress reaction. And it can cause you to have some difficulty focusing your attention and cause difficulty in receiving and processing information. So hopefully shortly after you had that immediate reaction, you started to then come back down a little bit off of that, and you were able to focus again, and you were able to function well. And that's pretty typical. Repeated exposure to stressors over time does result in an accumulative stress. So we can have some signs or symptoms of acute stress, and you can find these on page 37 in your text, or we'll just flip the page here. Nausea, vomiting, tremors, shaking, feel a little uncoordinated, sweating, chest pain or tightness, difficulty breathing, diarrhea, dry mouth, headache, sleep disturbance, vision disturbance. Cognitively or mentally, from a, we'll say an intelligence standpoint, confusion, you may have difficulty creating certain calculations and logic, poor concentration, poor memory of events, difficulty making decisions, and disorientation. Emotionally, you maybe are anxious, you may be in a state of denial, fear, or panic, feeling overwhelmed, angry, numb, and behaviorally, you may have an increase or a decrease in certain activities. You maybe are particularly hungry all the time. You may be withdrawing from sex or other interests, crying, suspiciousness, changes in appetite, maybe smoking more. The good thing about this is the longer we practice our craft here in EMS, the less of a reaction we have to this. So when the tones go off or the pager goes off or you get a call or whatever, the more you've done it, the more that you have honed your craft and practiced it, the less anxious and stressed you get in the situation, because you are more confident in your abilities and you're trained. So your very first ambulance call, you probably didn't know anything, and so it was very much a stress reaction. Let me tell you, after doing it for a couple of decades, yeah, is it stressful? Sure. The biggest thing that stresses me now is getting called out in the middle of the night, so I'm not able to sleep. The reality of it is most calls don't give me much of a stress reaction anymore. So that cumulative stress to those repeated exposures, it really starts to cause us to get exhausted and or burned out. And I've been burned out. I probably am burned out now. But so I've been there. I've been to that phase in which in my career I was so sick of being up for 30 straight hours running ambulance calls that it was just to the point in which I said, I have to move on or I have to get out of this field. So I moved to a different location where I wasn't running 24, 25 ambulance calls in a 24-hour period. That's a lot. So we have to look at alternatives. How can we change this up? So signs or symptoms of cumulative stress and burnout: fatigues, headaches, GI problems, changes in appetite, muscle and joint aches, poor memory, disturbing dreams, difficulty thinking, decisions, anxiety, boredom, apathy, or just don't care, emotional exhaustion, feelings of guilt, depression, paranoia, suicidal thoughts, irritability, increased smoking and alcohol, increased or decreased food, withdrawal and avoidance, substance abuse. Those are all things that are leading you to believe, hey, I'm maybe getting a little burned out in this. And then we also have post-traumatic stress disorder. And post-traumatic stress disorder it's not a terribly common thing in EMS. However, when we have usually a larger event, a significant event has popped up, the death of a child or something like that, we certainly could take that one home. We could take that mental image home. We could take those wake us up in the middle of the night, keep us from sleeping, cause us to have significant emotional responses. Those are the responses that we get, and usually they're delayed. That is PTSD. And they can dramatically affect our entire lives, including our careers in EMS. So natural disasters, you would imagine that people obviously involved in acts of war, as well as rape and assault and abuse, terrorist attacks, those sorts of things, there would be lots of PTSD. So how does it interfere with the normal functioning? It kind of overrides, it starts to take over your life, starts to really kind of control you. It's different from kind of your standard, well, I thought about that call a little bit. It's one that almost dominates you. So those signs or symptoms of a delayed stress reaction, PTSD, again, fatigue, headaches, GI problems, changes in appetite, joint and muscle aches, poor memory, concentration, nightmares, and flashbacks, probably kind of the red flags there. Difficulty thinking and making decisions, anxiety, boredom, apathy, difficulty in your interpersonal relationships. So now it's starting to affect your daily life. Emotional exhaustion, depression, paranoia, suicidal thoughts, guilt, irritability, decreased food intake, withdrawal, and substance abuse. So some stress coping mechanisms, short-term, less helpful mechanisms, denial, acting out, or trivializing, making light of it. These sorts of things are kind of an immediate, sometimes they're almost an outburst, but they really don't help us deal with the situation. Occasionally we also have things such as displacement, intellectualization, reaction, and alcoholism, workaholism, and escapism, where we're constantly pouring ourselves into something else. We're trying to remove ourselves from being in that zone that we have time to think about it. We excessively read about things and try to get a reaction. Or we suppress things. We just say, oh, well, I can't think of that. Move on. And then mature mechanisms. So consciously choosing to put distressing thoughts and feelings aside temporarily until there's a more favorable time to deal with them, such as you're angry or something your partner did. Distraction, temporarily involving oneself to redirect those distressing thoughts until you have a time in which you can deal with them. And when we say that, that doesn't mean 10 years down the road. That means I have to get through this call, I have to get through this shift, and then I'm going to do something about it. And you actually have to do something. And then active problem solving, finding ways, talking to some people. There are lots of resources out there for people that are dealing with stress. There's a lot of stress in this job, so we have to be very careful. We have to be aware of it. That's the biggest thing, is we a lot of times just aren't even aware of it, that it's affecting us. So talk to people. Motor vehicle collisions are one of the greatest safety risks for EMS providers. They don't usually end well when you're talking a crash like this. I can remember, it's not been all that long ago, there was a fatality accident involving an ambulance from Carroll County, Iowa. It was a bad deal. And anytime that there's an accident, it's not good. But you then go and somebody's killed in the process. You've killed, and particularly if you kill one of your own. We just recently had a fatality accident here in Nebraska, in which a man driving, an EMT driving, was killed. People in the back were all injured, and it really makes you stop and think. So what sort of things stress us out as EMS providers? Well, it can be work hours, workload, and pay if you're in it for all of that, because oftentimes we don't work a 40-hour work week. We may be on call 100 hours a week or more. The workload, there may not be enough EMS providers. We may be really short-staffed, so we're working extra. We're going on extra calls. Conflicts with coworkers or supervisors. We're never going to get along with everybody. There's always going to be somebody who we just can't see eye to eye with, and sometimes that actually ends up being our partners. Failure of other drivers to respond to your emergency vehicle lights and sirens. Another reason why you shouldn't use lights and sirens, because it just stresses you out, creates more of a headache for you to save literally. On average, the statistic is 42 seconds of time. Confrontational or difficult patients. We never run into difficult patients. We never have those. Difficult patients that really tax us mentally to remain tactful and remain professional. Fear of making wrong decisions or making mistakes. We can fear that. Particularly, it seems like it's a bigger issue to us when we're early in our career, that we have the potential to make a mistake. It's probably something we get complacent with the longer we're in EMS, is that we are human, we are fallible. Just constantly seeing people that are dead or dying, the abuse and neglect, calls with children. Many of us have children, or we can relate. Multiple casualty incidents in which you can't do everything you've been trained to do for every person. It hurts you. You really start to feel and go, gosh dang it, I feel like I could have done more. Injury or death of a coworker, that's killer. That's terrible when you have a coworker that's gotten ill or killed, particularly in the line of duty. It's instantly a humanizing thing. A lot of times EMS providers act more robotic than anything, but it instantly humanizes you and makes you think twice. And seeing severe or disfiguring traumatic injuries. For some people that's a big deal. For other people we think it's pretty stinking cool. So mental health. Mental health personnel often play a big critical role in response to disasters. You hear every time that there's a child is killed or there's a shooting or whatever at a school, that counselors will be on site because they know that there's going to be people affected by this and they need to get it talked out. For some reason in EMS we have discounted this, that it will work for us, and that's absolutely false. I think most EMS professionals at some point or another in their career do visit a professional, and it's okay. It doesn't have to be taboo. It doesn't have to be something that you hide from. They can counsel EMS personnel suffering from these different stress-related symptoms and help you develop effective coping strategies, not unsafe sex and lots of drugs and alcohol and eating terribly and sedentary lifestyle. They can help you develop a mechanism. So some other mechanisms that we mentioned, this is just a repeat slide, so I'm not going to go into this one again. Aspects of your physical wellness, you have to consider disease and injury prevention. What sort of things can you do to protect yourself? And it is a protective thing. When your employer offers you an immunization, take advantage of that. All EMS, actually it's I believe it's all public safety, so it'll include fire, EMS, and law enforcement agencies are required to give their employees the opportunity to have the hepatitis B series free of charge. They cannot charge you for that. So it's an expensive series. It's well over $100, I think, per shot. It's not cheap, and it's a series of 3 shots. So if they give you the opportunity to get that, get it. Give you the opportunity to get a pneumonia shot, a shingles shot, a flu shot. Strongly consider those things. To do TB skin testing, to do a titer for your hepatitis B. Do those things. That's helping to protect yourself. Injury prevention. Do they give you the tools to protect yourself? Now, while they've basically proven that those back support belts are minimally at best effective, there may be things, do they tell you that we want you wearing this harness when you're in the back? That's coming. They're finding ways that providers in the back of a moving ambulance will always be somewhat restrained. Use those. Get adequate sleep. So what that does mean to EMS providers is it's probably not a good idea to work 2 full-time jobs, one of them in EMS and one of them another one, that you get off shift at 7 a.m. and by 8 a.m. you're pulling in to work another 8-hour shift at your other job. You can't do that for very long. You need your sleep. Sleep is when you restore and you reset and you recharge. And burning the candle at both ends and up the middle can really, really affect your life and your health. Maintaining a healthy body weight, so that means good nutrition, that means physical fitness, working out, keeping yourself strong, stronger muscles all around, burn more calories, therefore they burn fat quicker. Not to mention if they're constantly getting used and challenged, they're building up a better tension and more strength, and your posture becomes better, and your risk for injury lowers. Major sources of potential risk for EMS providers: motor vehicle collisions, back injuries, violent patients, and exposure to communicable diseases. To me, the most dangerous one here is the violence, because people are unpredictable. If we're careful, we can do a pretty good job of protecting ourselves from motor vehicle collisions, back injuries, and exposure to communicable diseases. We have resources, but it's that completely unpredictable nature of the person that is probably the most worrisome. We also get challenged by sleep disruptions and unusual schedules, and working holidays, and working nights. And maybe we're working a shift. Maybe we're working a shift that is very slow. I've talked about running over 20 calls in a 24-hour shift. I've also had shifts in which I ran one call in a 24-hour period. honestly, it sounds great, but it wears on you. So lack of healthy food choices while we're on duty. So often if you're in a paid service, it might be on your way to your next call, you drive through a drive-through and grab something. We don't often have great food choices. Better option would be to bring a lunch. So sleep disruptions, oh my, that can be terrible. One of the main reasons why I left the field and went into a governmental role is because getting up 4 or 5 times every night after midnight when you're working a shift, it was too much of a toll. Most common causes of severe injury among EMS personnel are motor vehicle collisions. I keep harping on this, but it is oh so true. And motor vehicle collisions are the most common cause of traumatic death in all people under the age of 44. I'm sorry, 44, under the age of 44. There's a saying that I've heard numerous times that really the age of 40 is the dividing line in your life. Under the age of 40, you die from stupid stuff you did right now. Over the age of 40, you die from the stupid stuff you did 10 years ago. So, because you didn't take care of yourself, you didn't eat right, you didn't exercise, those are the sort of things that eventually come back and get you. Also, we're lifting and moving patients and equipment, and a lot of it's heavy equipment. And we put a patient, a 200, 300, 400-pound patient on a 175 to 150-pound cot. And now we have to lift this all up, and we have to move this all around, not to mention probably a 20 or 30-pound jump bag and maybe another 15-pound cardiac monitor, and and it goes on and on and on. So we're constantly having potential opportunities to injure ourselves. So lifting safely requires proper mechanics and following the guidelines. And so we'll kind of look here at their pictures in their demonstration here. Proper lifting technique includes getting into position. So that's keeping your feet about shoulder width apart, slightly turned outward, and then flat on the ground. That's the most stable position to be in. It keeps you from rocking so much. If they're straight forward, you have a greater chance to teeter side to side. It helps reduce that teetering, and it gives you a wider base. If you have your feet absolutely positively together, you're trying to do a balancing act, whereas you don't have to worry as much about balance here. Then going to lift the cot. As the lifting begins, keep your back locked. Just try to keep it as straight as possible, or actually I should say in as normal alignment as possible. Tighten the muscles of your back and abdomen to splint your lower back, and bending at the knees, push yourself upward. So return to that standing position. Make sure your back remains locked, and the upper body comes up before your hips do. So a couple other key points there. Keep your palms up when possible. You have better strength lifting upward that way as opposed to trying to have the backs of your hands upright. You're supporting that weight as opposed to, you're more or less pushing that weight up as opposed to pulling it up. Don't rush. Take your time. Make sure you have appropriate personnel. If you don't think that you can lift them, then don't. Get more help. Wide bases of support might help to also have one foot slightly in front of the other. Bend at your knees, lower your buttocks, and then keep your chin up to maintain your spine position. Communicate. Everybody lifts at the same time. Somebody's in charge, and only one somebody's in charge. Inhale, tighten your muscles, and then exhale while the large muscles or the quadriceps do the work. Do not twist or turn. Twisting or turning puts excessive stress on whatever structures you're using. And then whenever you can, walk forward. That's why we typically have handles on the foot of the cot, so you can pull it along. So proper lifting relies on having good muscle strength, good posture, good nutrition. You have to have the fuel to do the job, and a fairly normal body weight. You don't want to have to lift your excess body weight in addition to the patient and or their excess body weight. So definitely something you got to keep in mind. We're often responding to situations in which we potentially have the violence and injury. Remember, scene safety of yourself, then your coworker, then your patient, and then finally anybody else. Doing an adequate scene size up will help you eliminate a lot of the potential violence or a lot of the potential harmful scenes. It won't do it all. You have to constantly be aware. Personal protective equipment also helps you to protect against those infectious diseases. So, and you must recognize when you're in jeopardy, and you may have to leave the scene until it's safe. If the scene becomes unsafe, you either immediately make it safe or get out of there until it becomes safe again. So what are infectious illnesses caused by? Well, that's a lot of different potential things. Different microorganisms, lay people call them germs, but it can be things such as bacteria, can be viruses, can be small animals, can be such as certain parasites, can be other microscopic little pathogens such as prions or fungi for that matter. And what are communicable diseases versus infectious diseases? Infectious diseases are those that that people have. They're infected, they have something, and then patients can pass some of those on to you. Are ones that you can get from someone else. So, and then pathogens, I already basically mentioned those. So here's a brief list, actually it's 4 pages of a brief list, of some infectious diseases of concern to us. HIV and AIDS talks that it is a virus, the human immunodeficiency virus. It depresses the immune system, makes us susceptible to infections, typically transmitted through blood or blood-tinged fluids, body fluids. Typically it's considered to be more common in IV drug users and those using unsafe sex practices. It is rarely transmitted via an accidental needle stick, but it can be. Prevention, just your standard universal precautions, your standard precautions. And good hand washing. It's a relatively weak virus outside the body, so if you spilled HIV blood on the floor, by the time you went and got the mop to mop it up, chances are pretty good that the virus is already dead because it's been exposed to the sunlight in the air. Unlike hepatitis, the hepatitis B and C are both viral, caused by the respective HBV and HCV viruses. They cause inflammation of the liver and decreased liver function, commonly also transmitted in blood, body fluids, and other contaminated objects. It is a very strong virus. In fact, it will live in a little bit of dried blood on the floor for 2 weeks or more. And basically standard precautions making sure that we're washing well and we're using disinfectants. There are certain types of disinfectants that we're using to clean up contaminated equipment. We need to make sure that it is appropriate to combat hepatitis. There is also the hepatitis B vaccination series. Not all the hepatitises have a vaccine. A and B do. Tuberculosis, or TB, this was once previously thought to be nearly eliminated in the United States due to an influx of non-native United States residents. There's been an increase in TB's resurgence. It's caused by a bacteria, and it can infect a lot of different tissues, but the one we think of all the time is the lungs. TB is typically spread by droplets from the respiratory tract. They are starting to become more and more antibiotic resistant. You use a standard precautions as well as an N95 respirator, or a certain type of mask that is intended to keep you safe from very, very, very small droplets. And you can see a picture of an N95 on page 49 in figure 310. That's an example of, a lot of people call it the duckbill mask. The patient does not get the N95, the providers get the N95. If the patient isn't on a non-ray breather to catch some of their droplets, then the patient gets a regular surgical mask just to catch things. The N95 it's not easy to breathe through, so a patient with difficulty breathing, particularly somebody who has TB, this would actually be a higher risk for patient deterioration. So, and then of course disinfecting. Meningitis, or particularly bacterial meningitis. Bacterial meningitis is obviously caused by bacteria, and there are different forms of meningitis. There's viral, there's fungal. The worst one is bacterial, and it causes an inflammation of the linings around the brain, and can be, and in many cases is, fatal or have debilitating results. It is transmitted through oral and nasal secretions, and again, standard precautions, just a regular face mask. You don't need an N95 for this. You just need something to keep the drop out of your mouth. If they have suspected, if you suspect the disease, the people to be suspicious of are those with a stiff neck and light sensitivity. People with TB, they typically will complain of having a productive cough and night sweats. Pneumonia, there's all kinds of things that cause this. Pneumonia is an infection in various areas of the lung, typically causes shortness of breath. It is also a respiratory bound disease caused by their secretions, and in most cases, standard precautions is appropriate, so face mask. There are vaccines for both bacterial meningitis and pneumonia. They are available for certain populations. They're not standardly recommended. Staph, you could have all kinds of different staph infections, impetigo, MRSA. These are bacterial infection. Many of them are like such as MRSA are antibiotic resistant. Typically get infections. Patients that are constantly, or healthcare providers constantly around these sick patients can pick these things up. You honestly have staph in your body already. You have MRSA on your body already or in your body. You just, keep it under control. Skin contact with any open wound or contaminated subject. Typically people with MRSA, you find that they have MRSA of either the sputum or the urine. And then your standard precautions, what you need to do. The flu, influenza, either H1N1, influenza B. It's a group of respiratory viral illnesses that range from mild to fatal, and can also lead to or from pneumonia. Usually they'll have fever, cough, stiff joints, nausea, vomiting. The influenza, when you have the influenza, you are whipped for a week. People get flu-like symptoms and they're sick for a day, but when you really actually have the flu, we're talking a week or more. It's usually seasonal, respiratory again. Standard precautions usually are sufficient. There is usually an annual flu vaccine. Some people will complain, well, when I get a flu shot, I sometimes still get the flu. Well, you know what? That's really, because it's a crapshoot. They have to kind of guess which strain it is going to be big this year, and they don't always get it right. German measles, which is known as rubella, common childhood disease. Rashes, headaches, fevers, runny noses. It's in particular concern if a woman gets it within the first 20 weeks of pregnancy because of the ability to potentially cause some issues with the fetus. Also caused by respiratory droplets. If you are up to date on your vaccinations, such as your MMR, the R is the rubella, you should be good to go. Standard precautions. Pertussis, or the whooping cough, is a bacterial agent, causes severe persistent coughing, kind of like a whooping crane. Lately have seen quite a bit of it in the United States. It is also a respiratory airborne disease. There is a vaccine for it, and if you get a DTaP, which is a form of a tetanus, tetanus, diphtheria, and pertussis, you generally are in pretty safe shape. Severe acute respiratory distress syndrome, which is SARS. It's viral. There was a huge outbreak in 2003, caused global widespread panic, but there hasn't been a SARS outbreak since 2004. Severity of the disease just kind of is watched, but not something we routinely deal with. Also respiratory borne, and you should include standard precautions in a face mask. So I'm hoping, if nothing else, those last couple slides showed you that there's a lot of crap that's floating around in the air, and maybe just gloves alone is not everything we should be doing. Maybe we need to think more about eye protection and masks. Your eyes are one of the most absorbent tissues in the body, so eye protection can be a lifesaver. So we have some different terms that go along here with transmission, direct versus indirect, respiratory and bloodborne. To identify those, you can take a look on page 43 in your textbook and see that direct transmission, the infected person and a non-infected person are in close proximity and one passes it to the other. Indirect, though, this is when something survives for a long period of time, and maybe it's a completely different patient you now put on your backboard, and they picked up the hepatitis B because you didn't clean your backboard well. Respiratory versus bloodborne. Obviously, I think they're pretty self-explanatory, but respiratory transmission, obviously through the respiratory tract, and bloodborne, you have to have usually blood-to-blood or blood-to-mucous membrane contact in order for that to occur. A couple other terms to throw in there: virulence versus dose. And when we're talking about some of the specifics that have to go along with transmitting diseases, just by the by, if you were looking for that chart, the last 4 pages of chart, you can find that in your text on 44 and 45. Virulence has to do with the strength of an organism. So something that is very virulent has it's strong. So inside the body versus outside the body. Dose then be the amount that you come into contact with, very much like when we give a medication. What's the dose? It's the amount we give. So some infection control concepts to at least consider. We have to have training. We have to have administration. So we're having policies. We're having classes that tell us how to protect ourselves. Both Iowa and Nebraska require, at least on a semi-annual basis, biannual basis, at least on every 2 years, that you have some sort of training in personal protection and infectious disease. We may also have those policies in place. The time to wonder what the policy is or where to find the policy is not when you just got a needle jammed into the side of your finger. You should have an idea of what that policy says and know where to find that should this happen. But you shouldn't have to be calling around saying, well, I got exposed, what do I do? There has to be an infection control plan. Every service should have that. We have to have some engineering controls. So we need to have gloves, masks available, whether we have certain types of sterilization processes. We use various different types of disinfectants. Maybe some of the engineering controls might be on our IV needles. When we're going to use IVs or start IVs now, all of our needles generally are safety IVs. So there's some sort of a protector that goes over the tip or protects you from being able to stab yourself with that IV needle. And that's an example of an engineering control. Sharps containers a lot of times have kind of a one-way trap in it that you can drop something in it, but you can't easily get something out of it. You also have to have good workplace practices. So your habits. Are you constantly washing your hands or using an alcohol-based hand sanitizer? What do you do when you start an IV? Do you throw your needle on the floor, or do you have it set up where you can easily ditch your needle into a sharps container? And you have to take advantage of the personal protective equipment. Your employer is required to supply it, or your service is required to supply it, but it's up to you to ultimately use it. Additionally, good health. If you're a healthy person, you're strong, your chances of coming down with something after a very minor exposure to something is much less. Keep up on your immunizations. Keep yourself cleaned up as well. Hand washing. Your best defense against getting an infection is nice, intact skin. Even better than gloves is good, intact skin. Most of us can't say we have perfectly intact skin on our hands, though, because you've got a hangnail, or you cut a nail too short, or you got a nick or a cut or dry skin or whatever. But hand washing, and it's okay, guys. You can use some lotion. They now have man lotion out there that smells more like a dude instead of a flower. So it's okay to use those things to make sure your skin remains intact and gives you that additional barrier against any of those potential issues out there. Other specific measures. How do we clean up certain contaminated items? Do we have a specific policy? Paramedics routinely use something called a laryngoscope to put an endotracheal tube into somebody's lungs. Most of the time, the laryngoscope blades are reusable, and so there needs to be a way that is listed that we clean these. Where do we clean them, and with what, and for how long, and so on and so forth. How do we clean up our backboards? Where do we clean up our backboards? If you have a patient that's trashed your ambulance and you have a bag full of biohazard, and you're at the hospital ER cleaning up the truck so you can go on your next call if necessary, you're supposed to leave that biohazard bag at the hospital before you leave. You're not supposed to take it with you back to your station. It's just spreading the potential spots for contamination. So it's supposed to stay there. How do we clean and disinfect the ambulance and the equipment? Most people don't realize this. A lot of your sprays that you use as a disinfectant require to stay wet and on that surface for 10, 15, 20 minutes to be fully effective. Most people spray it on, wipe it off, and it's just that quick. You're not really honestly doing it any justice. You're not giving it the full effect to just spray it on and wipe it right off. So you need to know those things. And again, you have to take advantage of the PPE. The concept of standard precautions. Standard precautions assumes that everybody is potentially infectious. The most common one we use is PPE. When I started a career 23 years ago, gloves were a rarity. Most people didn't wear gloves. And we usually use non-sterile exam gloves. So we usually have a box of 50 or 100 gloves in various sizes sitting in the ambulance. We grab them on our way out the door and into the house. It is best if you wait to apply your gloves until you're walking up to the patient. Have them in hand. You can be ready to put them on at a moment's notice, but the longer those gloves are on your hands, the more heat, the more sweat, the greater chance that you're going to break down a glove or break a glove and increase your exposure. Not to mention they make your hands hot and sweaty. So as you're approaching the patient, if you're putting on gloves, that helps that patient also feel a little better that, hey, he's putting on fresh gloves for me. He didn't wear those for the last 3 patients and he hasn't taken them off all day. All right, so to put on your gloves, use a gloved finger, or pulling them off, I should say, removing. Use a gloved finger, kind of grab underneath the cuff there, pull down. Do not touch the inside of the glove. Turn it inside out. You can see how he's doing that there. Okay. Then with your other hand, with the ungloved hand, take your thumb and hook it underneath the cuff of the still gloved hand. Pull it downward, and you can actually pull them into a little package themselves there. You practice that a little bit, you can get pretty good at it. So, and then obviously dispose them in the proper container. I will not say into the biohazard container because it's not always appropriate for them to go into the biohazard container. What has to go in a biohazard container is anything that has the potential to really spread the infection. So in most cases, you could say if you could squeeze a drop of blood out of it, it should go in the biohazard. If you really couldn't get a drop of blood out of it, you probably can put it in the regular trash. And if it's not sharp or potential to be sharp, it doesn't go in the sharps container. Hand washing. Hand washing is the most important step to preventing the spread of communicable disease. So, wow, we repeat that there. You can also use waterless alcohol-based hand sanitizers that will work in a pinch until you can actually get to good hand washing. So soap and water. They recommend you keep your nails trimmed back, no artificial nails, no jewelry that can trap microorganisms. So keep it simple. A lot of if people are going to wear, say, a wedding ring in the field of EMS, it's best not to get things with lots of nooks and crannies in them. A completely smooth band is going to be much easier to clean up than it is something that's got lots of little diamonds and gems in it. So they can trap microorganisms. If you do wear jewelry, take your ring off, wash your hands well, wash up your ring, wash your watch. Those, basically the same thing. So washing your hands includes obviously running the water, getting your hands wet, applying the soap, lathering up, preferably going a little bit up beyond your wrists for at least 20 seconds. A lot of times they say sing happy birthday twice. Don't forget to cover all the areas, the backs, the fronts, the palms, the wrists, under the nails, tips, so on and so forth. Rinse the soap off of your hands. Dry your hands with paper towels, preferably no blowers, paper towels, and then discard those and then use a different paper towel to turn off the faucet and obviously to dispose of those. And in some places they even say use a paper towel, another clean paper towel, to open the door to the bathroom or wherever you just washed. Other protection. So masks, eye protections, gowns, so on and so forth. Suctioning. Suctioning obviously is kind of an ugly thing. I don't think anybody likes to suction. But suctioning is something that you really have to be cautious of because there's lots of splashing. So at the very least, don't sit there with your mouth wide open while you're suctioning somebody. It's going to keep their vomit out of your mouth. Sharps. This is a puncture-resistant container. Some of them have one-way little valves on them. This one does not. Several of your syringes will be made of glass. Most of your containers, vials and ampules you'll have are made of glass. They need to go in there. Respiratory and eye protection and fluid impervious gowns should be used when airborne droplets can be splashed or sprayed on you. Gowns are not always appropriate. It depends on the setting we're in. Sometimes the setting we're in, it actually would be more of a danger to wear a gown than it would be to not. So you have to take it with a grain of salt. Face masks will protect your mouth and nose, and then obviously when you're done, place your PPE in the proper disposal receptacles. I really kind of like, I'm going to back up for a second here, really kind of like these dual face mask eye protections. It's not perfect by any means, but it'll protect you from a lot of stuff, particularly say suctioning like this. Things that are going to hit you from directly on. If you got things spraying or aerosolized, you're going to want something that's a little more protective, but this is at least something. So exposure occurs if infectious material comes in contact with your mucous membrane or non-intact skin. So what you should do is immediately wash the area with soap and water. If it's in your eyes, irrigate with water or saline for up to 20 minutes. Get as much of that out of there as possible. Contaminated equipment and surfaces need to be handled by one of the few methods here, either disposal, cleaning it, sterilizing it, disinfecting it. And there is a difference. There's a difference to many of those procedures there. Cleaning is simply removing really the visible dirt and the visible soilings of it. Disinfecting is typically using some sort of a cleanser or a cleansing wipe to clean it up and remove as much potential for contaminated material beyond there. Disinfection a lot of times is using something that's either a chemical, a commercial chemical, or you can use like 1 part bleach to 10 parts water to create a decent disinfecting agent. It certainly, though, can damage your clothing. Sterilization, on the other hand, uses a variety of processes, UV light, chemical, steam, what have you, to kill all the microorganisms on an object. Sterilization is the best method, but is not always the feasible method. We don't have ways to sterilize. Most places, if we have to sterilize something, we have to take our equipment to the hospital. Disposable goods need to be used once and disposed of. So you don't reuse C-collars. So you use a C-collar on a patient, you leave it on the patient, they take it off at the hospital, it gets ditched. It doesn't go back up to the equipment locker. We talked about those. All right, so to move on, sleep. People in the United States are chronically sleep deprived. We sleep far less than the recommended 7 to 8 hours per night, and sleep deprivation has been shown to have significant health issues associated with it. So it can jeopardize not only yourself, your partner, your patient, and the public. I think all of us probably at one time or another have found ourselves what I like to refer to as pecking corn or falling asleep while driving, while your head keeps dropping down, your chin almost hits your chest, and you wake back up. So I think we've all found ourselves doing that. And remember, it's unsafe. Being fatigued and driving is almost, if not more, dangerous than being drunk and driving. So significant association between sleep deprivation and patient care mistakes. There's significant support and research that says 24-hour shifts for particularly EMS providers probably shouldn't be happening anymore. Not everybody's bought into this yet, but I can say without a doubt, after 16, 20, 24 hours of being on duty and running your butt off, there is no way a person is nearly as good of a provider as they were when they were fresh, when they first came on shift. And I would strongly support agencies removing 24-hour shifts from their standard work routine, particularly those agencies that are busy. You know, if you're running 2 or 3 calls a shift, that's probably not quite as bad as if you're running 9, 10, 12, 15, 20 calls a shift on the same truck. That's definitely increased risk. So you can have some shifts will even, or some places will even let you work a 48-hour shift. That's probably worse. No, that's not probably. That is worse. It's just there's too much potential for there to be sleep-deprived personnel that are going to hurt somebody, themselves, their public, what have you. So some tips for some healthy sleep or sleep hygiene. That's a pretty way to say it. Go to bed only when you're sleepy. And if you're not asleep in 20 minutes, get up. Do something until you're sleepy. If you wake up during the night, do not look at the clock. Do not nap throughout the day. And if you must nap, limit it to no more than an hour. Maintain your sleep-wake cycle on your days off. Do not exercise 4 hours before bedtime. Develop rituals such as having a bath or a cup of caffeine-free tea, kind of to get yourself into the wind-down mode. Do not use your bedroom for studying, working, or watching TV. Avoid caffeine and alcohol for 6 hours before bedtime. Do not eat a heavy meal before bed, although a light snack can be helpful. And make sure your bed and bedroom are comfortable. Keep them dark if necessary. And then if you have a cooler room, more blankets rather than a warmer room. Nutrition. So we'll talk a little bit more about nutrition here. Obviously, we spoke of earlier in the chapter that we're not good at this, and this is tough for us simply for the fact that it's hard for us to get good meals. So things to keep in mind about this. Healthy nutrition helps maintain your normal body mass index, and it increases the health of your tissues and decreases health risks for many different diseases. Things you got to keep in mind. You just have to pay attention to what you're putting into your body. So things like checking labels, checking serving sizes. That's probably, I would almost bet a paycheck that the biggest problem that most people have with eating healthy is not eating the correct portion size. And I can tell you for sure that that is what my biggest problem is I like to eat, and I like to eat lots. In fact, my motto for many years was eat now, eat quick, eat lots, because you never know when you're going to eat again, simply because that's the way we do it in EMS. I've gone shifts where I've gone a whole 12 hours without eating anything, just simply because we ran nonstop. You need to have the variety. They recommend more plant-based items such as fruits and vegetables. Reduce the amounts of excessive fats. Whole grains are fantastic. And then limit some of your animal products. There's much more cholesterol in most of your animal products, and more fats. So they typically tell you rely more on the vegetables. Fill half your plate with vegetables. And then portion control, like I mentioned. Pay attention to your food labels. If you're watching your calories and your nutritional content, ingredients on food labels are in descending order of quantities in their food. So what is the most common thing in your food item is the first listed. It does take work. It takes a lot of work to plan for meals, and it can be so easy to just say, I know I brought this, but I don't want it, so I'm going to run through and get a burger. And then caffeine and alcohol can be beneficial, but in many cases they become out of control rather quickly. A glass of red wine every evening is not a bad thing. Red wine's got some good antioxidants in it. Caffeine even can help you be a little bit more awake. But again, it's very easy to step over the line. So you got to be careful that you are selecting the appropriate foods, getting them prepared, and storing them well. So we don't have refrigerators in most of our ambulances for our food. So a cooler, you might have to bring a cooler to work, or a insulated lunchbox. Cooking destroys bacteria in food, so that's generally a good thing. But also leaving it lay out without refrigeration causes bacteria to grow. And then check your use-by dates on your foods. Discard any food left out at room temperature for more than 2 hours. If it's supposed to be refrigerated, that is. Clean your surfaces. Don't use the same cutting board for vegetables and animal products. Wash your hands. Physical fitness. Looking at things such as a healthy body weight, muscle strength, flexibility, and cardiovascular endurance. So to reduce your risk of chronic disease, engage in at least 30 minutes a day for 3 weeks, 3 days a week. Wow. 30 minutes 3 times a week is a minimum that you should try to engage in a moderate exercise to maintain your health. Obviously, check with any physician before beginning an exercise program. Feels like I'm a commercial out of off the radio. And moderate exercise means increasing your heart rate to 60 to 73% of your peak heart rate. So usually there's a chart that you'll look at based off of your age, and increasing your heart rate into that zone, it helps you get into that basic cardio mode there where you're strengthening your heart. So to lose weight or prevent age-related weight gain, 30 minutes at least 3 days a week. Some things they recommend are aerobic activity, which means improves your cardiovascular. So swimming, bicycling, jogging, running, doing aerobics. Resistance exercises build muscle strength, and then stretching it helps you with flexibility. Additionally, do not use tobacco or expose yourself to tobacco users. In moderation, caffeine and alcohol can be good for you. Never drive or perform dangerous tasks under the influence of any mind-altering substance. More things. Install and test smoke detectors in your home as well as around your station. Wear sunscreen with at least SPF when you're 30 when you're outdoors. Use your protective equipment that's available to you when you're doing your recreational activities. So helmets. Wear your helmets. Even though you may not be in a state that requires them, wear your helmets. Seek medical advice when you have health concerns. Annual physicals. See your dentist twice a year. All right, so define the following. I think we've covered this already. Most people with families experience conflict between work and family. So it's very difficult for people outside of the realm of EMS to completely understand what it is we do in EMS because it's weird. I mean, it really starts to tug away our attention that we maybe used to give solely to our mate or to our children. And it's hard for them to understand. So, our lifelong learning and pursuit of knowledge and skills can contribute to professional development and intellectual wellness. So if you are uncomfortable with your abilities as an EMT, continue your education. Continue to gain more and more. Maybe it's a formal education. Maybe you decide that, well, I want to become a paramedic. Maybe I want to get my associate's degree or a bachelor's degree. Or maybe it's just informal. I'm going to read more articles. I'm going to search more stuff on the internet that helps me learn. 69% of all employees say that work is a significant source of stress. I think most of us can probably agree with that. The primary source of stress at work is their immediate supervisor. So you need to try to establish a decent working relationship. You need to try to step away from your work, whether that's EMS or something else, and de-stress. So employers who have psychologically healthy workplaces have higher employee satisfaction and lower turnover rates. Something I try to drill into everybody when I'm talking to services. It's particularly the paid services, but is build a healthy workplace and comforting workplace, a safe workplace, and you're going to have a lot better morale, and it's going to be even a bigger deal than giving people a raise. I mean, a raise is nice, but if you're happy and healthy in what you're doing, that goes probably a heck of a lot further than a pay raise. All right, so as your thinking changed since the beginning of class, I doubt many of you have really had much earth-shattering information here. Stuff that most of us already knew, but hopefully it refreshes in our mind and we can put some of it to use. So to maintain your overall wellness and achieve balance in the various aspects of your life, you have to take actions to minimize some of these risks that are critical to our self and to our satisfaction. There's all kinds of areas of wellness, including our emotional, environmental, intellectual, occupational, physical, social, and spiritual wellness. Careers in EMS have a lot of potential hazards and challenges for us, whether that's motor vehicle accidents, scene hazards, sedentary activity, or too long or irregular shifts, too busy, communicable diseases. Effective strategies for coping with stress can help us deal with some of that occupational exposure that we're going to have. Maintain your physical health and good nutrition. Get your immunizations. Use appropriate PPE. Take time out and get away from EMS. So one thing I can't emphasize enough, people need to step away from EMS for a while. It cannot be your whole life. If it is, your career will be short. Engage in your personal and professional learning activities. Stay well, stay informed, make good choices,